and metabolic health improvement, and is it a possibility regarding this approach and what we use in our office. I don't have much conflicts except removing barriers to healing using people, process, and technology. And my target is the chronic diseases as chronic diseases affect my patients and cause infections. And to try to improve infectious disease outcomes, I do think that we must also plan on improving chronic diseases like diabetes, obesity, and metabolic health problems that lead to most of the suffering of my patients that have wounds. And hence, I'm working on this process. And as you know, diabetes is a global pandemic, really. And with the current COVID, it's really a syndemic. And we have to know that a lot of people in US suffer, but globally there are 415 million people with diabetes suffering. And this is expected to increase to 642 million. And according to International Diabetic Federation, countries like China, India, and US are the top three nations that have multiple suffering patients. And these are a huge problem with 109 million people in China, 69 million in India, and 29 million in US suffering, with Brazil and Russian Federation being 14 and 12 million people suffering. In US, according to CDC statistics, 34.2 million people have diabetes. Of them, only 26.9 are diagnosed, 26.9 million are diagnosed, and 7.3 million not diagnosed. But a lot more do have pre-diabetes, where diabetes prevention programs do help. And of those people, there's 24 million people are older people with 65 or older people having that. So I want to present a case of a 69-year-old retired graphic designer, and he's going to give a patient's perspective video interview also, which I'm going to share. And he has had diabetes diagnosed in 2015 with him ending up with coronary disease and cardiac stenting, and he gained weight and he wanted help, and hence he was referred for diabetes and metabolic health improvement. And he had been suffering with kidney stones, erectile dysfunction, cardiac arrhythmias. His hemoglobin A1C in 2019 was 6.8. In May, when he was referred, his hemoglobin A1C was 6.7. He was on metformin, and basically he had improved with his weight coming down from 223 pounds. He was around 223 to 225 on May 5th, and he has come down by November 4th. He was 199 pounds. His BMI improved from 30.2 to the current BMI of 27.9. But as you can see, he lost 23 pounds. He felt a lot better. His brain fog, his erectile dysfunction, and muscle pain have improved. We did a body composition analysis, which we started in 2 months after his initiation of the treatment. So I don't have the initial body composition analysis, but the idea of metabolic health improvement is fat loss, not just using any program, but any program that documents the fat mass improvement, and hence body composition analysis with bioimpedance helps a lot. And here you can see that patients' body fat mass has come down from 65.3 pounds to 58 pounds. So his percent body fat improved. His BMR slightly reduced, but I think it will come back. He has to gain some muscle. And here I'm going to have him give his own perspective, and he will give you an idea of what's going on. Thank you for agreeing to speak with us today, and thank you for taking time. And Gary, tell me about you. Speak.
Well, I'm 70 years old. I had problems with my cardio, and the doctor did a stent or two, and but my weight was heavy. I wasn't very healthy, so they recommended I get on your diet, and we started your diet back in May, and I did what you told me to. You told me what to eat, told me how to exercise, and I did. I said, he knows what he's talking about. I'll do exactly as he says, and he was very inspirational. He helped me along, and I stuck with the diet, did the exercise, and I dropped these 25 pounds.
Yeah.
And
so you were diagnosed with diabetes in 2015, and 3 years later you ended up having, in 2018 you had a heart stent, and then when I saw you in around May 5th, I saw you on May 5th, and you were weighing around 223 to 225 pounds, and then we ended up trying to get you to understand the nutrition, and I'm so happy you understood it. And what I see here is this body composition testing that we did for you. Okay, so I want to show you that your diabetes has improved, but also we did not do this test before. We did not have this machine when we began your testing, but you are 223 pounds on May 5th, and then you ended up now. When we did this initially, this test, your body excess body fat mass was 39 pounds, and when we started to do this, now it's only 33 pounds. But then also, you kind of lost 6 pounds of fat since we started doing this. But you lost a lot more. But we did not have this test done earlier. But we also, by doing this test, we are able to see that your body composition, your BMI, it has improved, but also you did lose some muscle. So you need to do some muscle strengthening exercise and eat protein and do some muscle strengthening exercises. And tell me if you have any other questions. What questions do you have?
Well, I just would like to say, I went, my sugar was 6.8, I'm down at 6.0, and I'd like to get down to 5.7.
Or less. So basically, at this point, you are in, when you diagnosed, you were taking diabetic medications.
I was.
What were you taking?
Metformin.
Metformin?
I was taking 1,000 in the morning, 1,000 at night.
Uh-huh.
And I really wanted to get off of it as we talked. And so when I started this program with you, I quit taking it.
Yeah.
And of course, now I didn't need it once I lost the weight.
Yeah.
And did the diet.
And then your blood sugars, we tested your blood sugars, they are normal now, even with this diet. But then your hemoglobin A1C is kind of come down to pre-diabetic range. And then tell me how you feel. Forget about the weight part of it. Tell me how you feel overall.
I feel great. I feel like I'm probably really 5, 6, 7 years younger.
Okay.
I sleep well. I get up. I'm not drowsy anymore. I used to be kind of hazy, tired, unmotivated. And I feel like I did back 15, 20 years ago, which is great.
You did have fatigue, and also you did have elevated liver enzymes. Your liver enzymes are better now, and you did have some other issues that are happier with your like at home doing your work or something like that. You feel not tired anymore.
I feel less tired. I feel my mind just feels clearer.
Clear.
I think differently, and not so sluggish and not so cloudy. And I find myself wanting to take naps. I still like to take naps, but it's not as often. Okay. It's not as drastic.
So your wife is happier with you now?
Absolutely.
Okay. Absolutely. Okay. So you gave your wife a new husband then, huh?
Yeah, I guess so.
Okay. She is happy with that then. So thank you for taking the time and effort to give me this interview. And so what would you tell people about the program? If you had to tell in a little bit, what would you tell them?
I'd say simple. Is like I said earlier when I met you, I looked at you, you're nice and slim, you're energetic, you're focused and everything. And when you told me about your diet, I said, well, obviously this man knows what he's talking about. So I made my mind up that I was going to do exactly what you told me to. And
was it hard? Was it hard to do this proper human nutritional lifestyle?
I tell you, when you told me, you said, just be patient, eat the fat, the protein, just be patient, and your appetite will go away. And it did. I mean, my appetite, I didn't starve, I didn't do anything, I wasn't nervous. It all really smoothed out by the diet that you gave me. Is that I found myself, when I'd fast and not eat till 11 o'clock, it was easy. And then I would go with 4 hours and eat protein and vegetables and that sort of thing on your plan at 4 o'clock. And I might snack a little bit at 5 or 6, but most of the time I go right through, drank my liquids, drank my green tea and stuff, and sleep good. And then the panels was coming off. I just started feeling better and better and better. So the thing I would say that was really important to me was that I did what you told me to. I didn't cheat. I didn't want to cheat because I told myself, I said, if I can do this for 90 days and do it right, then I should not have to diet and struggle like.
But this is a lifestyle, though. So it is not a diet. So since you have gotten better with your diabetes, since your blood sugars are kind of normal, and the hemoglobin A1C will come down and it will normalize, and then it just comes down to you understanding that this is a lifestyle, then a diet, and you kind of sticking to that process. And then, if need be, maybe in 3 months, I will see you once, okay? And then if you have any questions, concerns, issues, you can come back again. Thank you very much for taking time.
Thank you, Doctor.
Thank you.
So basically, that was a lifestyle intervention for this patient, and the factors in this remission consensus statement that was released recently is showing that the intervention and the interval testing and subsequent measurements, whereas for pharmacotherapy, at least 3 months after cessation of the intervention, and then for surgery, at least 3 months after the procedure, and lifestyle, at least 6 months after bringing this intervention, and 3 months after cessation of pharmacotherapy. And that patient has stopped his medication earlier. And obviously, this consensus report talks about diabetes remission using more consistent terminology. And remission should be defined as a return of hemoglobin A1C to less than 6.5, and with following an intervention and persisting 3 months in the absence of glucose lowering pharmacotherapy. And obviously, fasting glucose should be less than 126, and also calculated hemoglobin A1C from CGMs of less than 6.5 should be the criteria. And obviously, 3 months after the treatment, after the intervention, we have to do the subsequent testing. And basically, counseling and lifestyle, I think, is a core of this whole problem. I do think that every human is the author of his or her own health or disease. That is Gautam Buddha saying. And obviously, Hippocrates had said that everyone has a doctor in him or her. And like I say, we deal mostly in medicine, in sick care, with problems like this, where I'm treating osteomyelitis and infection and wounds. But in reality, it is the attack of metabolic syndrome that is happening. And we ought to really work on improving the metabolic health of our patients and guide them through this whole process. It's a simple but also process that involves people, process, and technology. And we use telemedicine technology for food tracking and counseling, and also body composition analysis, and also fibroscan testing will be the future of the care delivery processes that we are planning to help our patients along. Thank you very much for your time and listening. Thank you. Take care.